We will begin with the second session of this particular module. In the second part of this module, what we are going to discuss is how does anthropometry works, how it works to assess, and second point, what anthropometric measurements and indices are used for the children and adolescents of the age group of 5 to 19 years to assess these particular problems. And then lastly, we have to see what are the tools, what are those tools or what are those indices which would help to interpret these problems and to assess these problems. So, what anthropometric measurements and indices are used for the children and adolescents of the age group of 5 to 19 years. Now, this section describes the anthropometric measurements or anthropometric indices which are being commonly used for this age group. Now, what are those indices or what are those measurements which we will have to look for to assess the problems? The measurements and indices which should be included and which should support not only just indices, but it also support what are the or you can say that along with these indices or along with this anthropometric measurement, the whatever the measurements we will have after doing the survey and whatever the indices which we will be using for interpreting, we have to also look for or we have to also see the health status, the dietary intake, the food security status, as well as the stage of puberty, the stage of growth, as well as the care practices. All those things we have to look for assessing all these anthropometric measurements and to give our what I can say the inferences as far as the this particular sub part of the anthropometric measurements and indices is concerned. Okay. So, how does anthropometry works? Means what are the things which works for anthropometry or what are the things which we take help of under the heading of anthropometry or under the technique of anthropometry, which would help us to assess the nutritional problems. So, the first is height for age, second is weight for age, third BMI for age, the fourth very important is MUSE, and the last but not the least is bilateral pitting edema. So, the first thing is measurement for height for age. Now, what is that height for age means? It considers the child or adolescent's height relative to his or her age as well as sex. This is very important, means how the indices is used, how any index which you use as a measurement, any index which you use as a measurement, you have to see how you compare it. So, what it considers height for age, what it considers? It considers the height of a child or adolescence in relation or as compared to his or her age and the sex, which will see we have seen what are those conditions in which the anthropometry is useful, and under those conditions or among those conditions we had gone through that condition, that condition was stunting. So, here this particular index, the height for age, that index always helps in identifying whether the child is stunted or not. Now, height for age, I said just now height for age. Now, if you look at a child of a age of 8 years and you see a adolescence of a age of 18 years or 19 years, and if you compare both the boy and a girl to see that, means how they grow in their height, you will find that for a girl the achievement is at a little earlier age. That means, at the age of 16 to 17, the child achieves almost 99 to 100% of her height, maximum height what she can get. She achieves around 16 to 17 years of her age, whereas as far as boy is concerned, it takes one more year. That means, he can achieve up to the age of 18 years and it may proceed on up to the age of 21 years. That is the thing which is differing in both sexes. So, that is what I said in the beginning, that height for age, when you say height for age, you should consider the sex in the picture. So, height for age, if you compare this chart for height for age and you see what is an average height in a boy as compared to the age, and what is the average height in a girl as compared to the age. And look at, I will just consider one example of a height of about 9 years of age. You can see the average height which should be there in the 9 years of age of a boy. You find that it is around 132.6 centimeters. This is described in the scale of centimeter, not any other scale. It is described under the scale of centimeters. So, it is 132.6 centimeter on an average for a boy of age of about 9 years. As compared to that, if you see in a girl, it comes to 132.5. So, it is little less, but as compared to, why I have taken this particular age group of 9 or age of 9, because if you see in this that the figures in a boy or a girl are more or less same, but if you just compare there onwards up to the age of 19, there is a big difference. There is a big difference. I can say you one more thing, that you see, just compare this chart and go through from 15 to 19. At the age of 15, you find the height on an average is about 169 centimeter for a boy, whereas it is about 161.7 centimeter for a girl. There onward, if you compare it with a boy and a girl, you find that for a boy from 15 to 19, he can grow on an average 163.2 to 176.5. So, that much height he can get or he can achieve. As compared to that, if you look at a girl, you can see a 15 years old of a girl, the height is about 161.7 centimeter, that can grow only up to, on an average I am saying, or that can go only up to 163.2 centimeter. See the difference between the height of a growing boy and height of a growing girl, and that makes a sense that when you use this index of age and height, or age per height, or height and age comparatively index under the category of technique of anthropometry, you should always look as per the different sex. That is very important. Now, look at this figure. You see, I have selected a figure where all the child or all those children seen in the picture are about 9 years of age, and average height we have just seen that it is about 132 centimeter. Just now we have compared the chart. So, it is about 132 centimeter. Now, look at those child, they are quite below those. So, I can call these child as a stunted child. So, this stunted child can be measured by this height for the age group. Then next, weight for the age. Second category, second index, the weight for the age. What could be the probable weight one should have as per his or her age? So, what does it helps? Means what does this index helps? This index helps to provide a better indication of nutritional status. This helps always. It helps to provide a better indication of nutritional status than the previous one. Why? Because it helps to differentiate the underweight, the overweight, and the obese child or adolescents. These are the three categories of a child or adolescent: underweight child or overweight child or adolescent child, the obese child and adolescents. You can see that all these three categories, underweight, overweight and obese, that can be categorized by using this index, weight for the age. Now, weight for the age is more used out of all 5 to 19, it is more commonly used in the age group of 5 to 10 years. So, weight for the age, what it does? It helps to compare the weight relative to her age or his age and the sex, and that helps you to identify whether the child is underweight. And you can see the reflex things when you say that a child is underweight. You can see that you may find the child is undervesting, you may find the child is stunted, or you may find both, a stunted child with a vesting muscle, and that has reflected the weight of the child to become underweight. That can be the thing. As well as you can see that you can differentiate this. If you use the weight for the age index, you can differentiate, or you will be able, you will be in a position to differentiate both those things. That means whether the child has undergone wasting or whether the child has undergone stunting, and differentiate between wasting and stunting can be done. The measurement or the index what we use for the weight for the age. Now, in children of about 10 years of age and more older than that, the BMI for age and height for age, especially when used together, provide a better indications of nutritional status than the weight for the age. But this is because weight for the age does not distinguish between whether the weight reflects relative height or a body mass. This is very important, which is particularly important during an age group when the child or adolescents are experiencing pubertal growth. See, in the pubertal growth, the weight and the height has got more importance. So, height, in the pubertal age they are spurting, so height is increasing. You may find height is increasing, and you may find a child or a adolescent growing in a height gaining excess weight in spite of the other things which can happen, or in spite of the BMR normal, the child is getting more weight just because the child is achieving more height. So, you can see these pictures where you can see a obese or a overweight child, or a overweight girl or overweight adolescent girl, and you can see the habits what we have already discussed in the first part that makes them to look like this. Coming to the next, measurement BMI for age. See, we have seen height for age, we have seen the weight for age, now we are going to see the BMI for age. Now, what is BMI? BMI for age is used to indicate both illnesses. Both the things, see, BMI for age is used, what it helps? BMI for age which will help you to indicate both thinness as well as obesity. See, both the things can be graded by BMI, as well as that can not only help us in the age group of only children, but also it can help for a non-pregnant adolescent which is coming under this age group. But on the other side, BMI is not a direct measurement of body fat, that one should keep in mind, that it is not a direct measurement of body fat, and as well it is not helping, or it is not going to help you to distinguish between muscle weight and the body fat weight. This is very important. So, how does you measure the BMI, or how can you come to the measurement of BMI? Now, BMI can be done, or BMI can be measured, it is a ratio, it is a ratio of weight relative to height, that means weight relative to height which is calculated in kilograms divided by height in meters, and you make square of it. So, the formula becomes the weight in kilograms divided by height in meter square. That can be the interpreted formula for any age and any sex coming under the age group of 5 to 19. This is an ideal formula where the weight in kilograms is divided into or divided by height in meters. So, that is an ideal formula. So, measurement of BMI is very important to categorize the child, whether the child is having healthy weight, the child is having overweight, the child is having obesity, or the child is having underweight. That is very important. So, BMI can be also used to assess the risk of health condition. This is very important. If the child or an adolescent is having high BMI or high value of BMI, always is a risk. There is a risk of certain health elements or certain health condition like heart disease, or even BMI can mean different things. As you get older, if you are of high or low fitness, this BMI will help you to categorize whether you are fit or whether you are unfit. So, BMI is a very important criteria to categorize all these important things in your life, and especially in this particular age group of 5 to 19. So, BMI for the age and height for the age, especially when used together. Now, see, we have seen weight for the age, height for the age, and BMI for the age. Now, if you compare both these, or if you calculate both these BMI for the age and height for the age, especially when you use together, they provide better assessment of nutritional status of a child or adolescent of the age group of 5 to 19. Okay. So, if you see this comparative, if you compare the BMI for the age and BMI for the this in both sexes, boys and girls, you can compare the BMI for the boy or a BMI for a girl. You can see an average as per the age or age. Suppose let us consider a age group of 5 or age of 5. You can see then average ideal BMI is about 15.3, whereas in girls it ranges from 15.2 to 15.3. You just take the middle age of about 12 years, then it becomes for a boy it becomes about 17 to 17.5 for a boy, whereas for a girl it becomes 17.3 to 18. So, it is more, you can see. And lastly, you go to the last stage of this group, that means 19, that BMI becomes about 21.8 to 22.2 in a boy, whereas it goes to 21.3 to 21.4 for a girl. So, there is a difference between a growing boy and a growing girl up to the age of adolescence. So, that you have to consider. Always this BMI will differ as you go from the different stages of your ages, right from 5 to 19. So, what could be the formula? Lastly, what could be the formula for using this BMI? So, there can be two ways the BMI can be measured, one by metric formula and second by empirical formula. Now, what is that metric formula, where you can use the metric indexes? So, BMI is equal to, as I said in the earlier part, that BMI is equal to weight in kilograms divided by height in meter square. This is a formula which is used under the category of metric BMI formula. Whereas, if you take empirical BMI formula, you can see that empirical BMI formula can be calculated by multiplying the weight in pounds divided by height in inches square. So, you get a figure, you divide weight in pounds by height in inches in square, and you multiply this particular figure by 703. That will give you BMI under the category or by the way of empirical formula. So, you can take examples. For example, you can take an adult. You take an adult of about 180 centimeter in height and about 75 kg in weight. So, what you have to do is, you have to in the first step what you have to do is, you have to convert this 180 centimeter into meter, and as you all know that 1 meter is equal to 100 centimeter. So, you convert 180 centimeter into meter, that the figure will come as 1.8 meter. Now, you plug both these figures together, 1.8 meter and 75 kg. So, what is the BMI formula? So, BMI formula says that you have to divide 75, that is a weight in kilograms, by height in meter square. That means, it comes to 1.8 meter into 1.8 meter, that comes to 3.24 meter. So, you divide 75 by 3.24, it comes to, the BMI comes to 23.15. So, that is the way in which the BMI is calculated. Now, this is a chart, this is an ideal chart where you can see that the percentile is, means the average healthy weight. You just compare, you take a child of about 12 years, boy about 12 years of age. Now, you can see the indexes, because one of the index you will come across afterwards, that is called as percentile. So, you compare one person with, this is an individual index. So, you can compare one person with another person, or one child with another child, or one adolescent with another adolescent. So, let us consider one particular person. You can see one particular person of about one particular child or one particular adolescent of about 12 years. Now, you can see that when the BMI is less than 14.4, you see that the child of about 12 years of age is called as severely underweight. Where it lies in the range of 14.5 to 14.8, it is just the underweight child. It is a healthy child when it goes to beyond 14.9, 14.9 to 24.3. That is a category, where you will find that the child is healthy. Now, once it goes beyond that 24.3, that means 24.4 to 29.2, it goes beyond that, then it becomes overweight, and when it becomes beyond 29.3 or it becomes beyond 30, it is severely overweight. It is called as severely overweight child. So, this is the way you categorize or you calculate the BMI, just to analyze in which stage the child or adolescent is lying, right. You take any example of any age group. You can take an adolescence of 18 years of age group. You can take adolescence of 18 years of age group. You see that when the BMI is less than 16.1, it is severely underweight. When it lies in between 16.2 to 16.6, it comes to underweight, whereas the healthy is 16.7 to 27.4. When it goes beyond 27.4 and it is less than 32.5, then it is overweight, but when it crosses the limit of 32.5, it is severely overweight or severely obese child or obese this particular adolescent. So, this you can see what can be the things which you have to keep in mind. Underweight child, where the BMR anyhow at any age group less than 18.5, then what you have to think about, or what you have to tell the child, or what you have to categorize the things which are required. One, you have to ask to increase the calorie intake, then you have to ask to do the plenty of exercise, and you have to follow the high nutritional status, which will help to increase the BMI. When it becomes overweight, that means it beyond 25, then what you have to ask for that particular child or adolescent. See, you need to reduce your weight. So, you need to reduce your calorie intake. You reduce your calorie intake, you have a good exercise. See the activity level, your activity level is very less, and that is why your BMI is very high and you have become overweight. Lastly, from overweight to obese, if you say obese, you have to explain. See, when it is going beyond 30, it is obese, severely overweight or obese. Now, when it is obese, there is a chance, you have to explain to the patient that there is a chance that you may stuck into certain illnesses like heart disease, you may find stuck into a metabolic disease like diabetes 2, or you may develop a stroke. All those things can happen. So, for that you have to advise the particular patient or particular child or adolescent who has crossed over the line of 30 BMR now about the exercise and all. So, apart from the height for age, weight for age, BMI, the next tool next index which is very important for us to assess under the technique of anthropometry, assess the nutritional status of the child or adolescent is MUSE. Now, what this MUSE says? The MUSE is a simple measurement. It is a simple measurement that can be used to identify the children who have malnutrited children under the stage of malnutrition, and they are having high risk, or they are coming under the high risk of dying. MUSE, middle upper arm circumference. See, what is important is this particular index is not only going to help you to categorize the malnutrition, but also going to help you to assess whether the child or the adolescence is under the stage that there is a high risk of dying. So, why it is used, how it is used? It is used to identify the acute malnutrition by measuring the circumference of the mid upper arm. This is very important. How it can be done? It can be done by using the measurement, taking the measurement of the mid upper arm circumference, and then see what is the degree of malnutrition, whether it is mild, moderate or severe, you can see, or whether the child is having normal middle upper arm circumference, then there is no sign of MUSE. But if there is any alteration in the dimensions of middle upper arm circumference, then you can categorize that whether the child is undergoing moderate acute malnutrition or whether the child is undergoing severe acute malnutrition, and that can be categorized simply by if the middle upper arm circumference you can see is less than more than 12.5 centimeter, it comes to normal, but when it is less than 12.4 centimeter, it is the moderate acute malnutrition, and it is less than 11.5 centimeter, it is severe acute malnutrition. So, MUSE is used to identify the acute malnutrition by measuring the circumference of the middle upper arm and comparing it with the established cutoff. Now, cutoff is a tool which you will have to use to interpret the things. So, commonly why this MUSE is been used, commonly used to assess the nutritional status. See, I said under the 5 and adults, see this is very commonly used under the age of 5, but for this age group also it helps to decide the nutritional status of the individual and what could be the steps to be taken for improving the health status of the individual. Yes. So, if you use this particular tool or a particular index MUSE and see the cutoffs and want to categorize under MUSE by using the tool or by using the index MUSE, if you want to categorize the underweight, overweight, obese and morbidly obese, then you can take help of both the things. See, you take the BMI category as underweight, overweight, obese and morbidly obese, and then see the BMI. What is the BMI? BMI for that you to call any child as underweight, overweight, obese and morbidly obese, and then you can compare that BMI with the MUSE cutoff. So, if you look at that, I can categorize under 4, one is underweight, second is overweight, third is obese and fourth is morbidly obese. If you categorize that, you can see underweight child whose BMI is equal to or less than 18.5, then you can see that the MUSE cutoffs comes to 22.80 centimeter. Whereas, a overweight child you can see the BMI is more than 25 and ranges up to 29.9, where the MUSE cutoffs comes to up to 27.10. Where you see obese. Now, coming to obese, see underweight, overweight and obese beyond 30. The BMI is beyond 30 to 39.9, where the MUSE cutoffs comes to 30.57, and you go further that morbidly obese, then you find that BMI is more than 40, it is more than 40, where the MUSE cutoffs comes to 37.32. So, you can compare this, means you can use these indices, use the indices of BMI, use the indices of MUSE, and then can categorize the children and adolescents under the category of underweight, overweight, obese or morbidly obese. This is very important. So, in short, this MUSE for assessment and admission, this is very important. How it helps in short, MUSE, it helps to identify the children at high risk of death. This is very important. By using this index of MUSE, you can categorize or you can understand whether which children are under high risk of death. Then it also helps to measure the muscle mass. That means the nutrition store. This is very important. Muscle mass is that can be because MUSE itself is middle upper arm circumference. So, you can measure the muscle mass. Then what is very clear is very important is it is very transparent and understandable measurement. This is very important because see you can have n number of indices or n number of tools which you can use under the category of anthropometry, but a tool or a index which you want to use or which you want to suggest has to be comprehensible to everybody. So, under that or among that the MUSE is very transparent and understandable measurement, and it can be very easy used to easy tool or easy index to be used. It can be used by all the healthcare providers for the community, and so that means not necessarily that you require a higher category of health community to do this MUSE. Coming to the last index which can be used for this particular bilateral pitting edema. So, what is that? What is a clinical sign? It is bilateral pitting edema is a clinical sign. One has to keep in mind that bilateral pitting edema can be seen in any other conditions, medical conditions, but always you have to keep in mind that when you see or when you take this bilateral pitting edema, one has to keep in mind that it has to be considered only under nutritional edema or edematous nutrition or SAM with edema or kwashiorkor. Always keep that in mind, because see nutritional the bilateral pitting edema can be seen under any nephritic disease, under any heart disease, under nephrotic disease or other illnesses like severe anemia and all, but you have to consider this only under nutritional edema and or edematous nutrition or the severe acute malnutrition with edema or along with the kwashiorkor. The bilateral pitting edema helps to categorize. So, bilateral pitting edema is a clinical sign, sign of a specific form of severe acute malnutrition. Bilateral pitting edema is a clinical sign, no doubt, but what it indicates? It should indicate the nutritional edema, SAM with nutritional edema, that means severe acute malnutrition as a nutritional edema, not just any other disease. Bilateral pitting edema is an abnormal accumulation of fluid. See what is that pitting edema? You see that there is an abnormal accumulation of fluid in the body tissue and causes a swelling. Now, that swelling usually begins in the foot. So, it is called as pedal edema. When it is only limited to feet, it is called as pedal edema, and it is always in the mild form, but from the feet it can involve the legs, then it can involve the thigh, then it can involve the hand, then it can involve the arm, then it can involve the face, and you can see the anasarca where the total generalized edematous condition. So, those are the things, those are the steps. So, it starts from the foot. So, it is to begin with, it is pedal edema, and that pedal edema may be restricted to one side or may be restricted to both, but for nutritional edema always see that whether it is bilateral or not, because you will never find nutritional edema unilateral, that one has to keep in mind. Unilateral edema can be because of any other illnesses which are which can be impending in this particular age group, including maybe related to kidney, maybe related to liver, maybe related to heart, but you have to differentiate these things, and that is why I said that this measurement not just pitting edema, it is bilateral pitting edema. This is very important. How you can assess that bilateral pitting edema? You just can press your finger for on that particular edematous part. You can see a depression being produced, and if that depression remains there for more than 3 seconds, it is called as pitting edema. So, that is the way in which you categorize or you label the edema as a pitting edema. So, that depression, that concavity which is being produced on the surface of that affected part on the skin, it should remain for more than 3 seconds. If it is not, then it is not pitting edema, it is non-pitting edema. So, that can have many other causes. So, you just have to keep that in mind, that always when you use this tool or when you always use this index, keep that in mind that it should be under the category of nutritional edema and not under the category of any other major illnesses where you can see the edema to be produced. Next, coming to the grading of malnutrition as compared by using the tool of the pitting edema. You just can use, means you just can grade the malnutrition. If there is no bilateral pitting edema, that means the pitting edema is absent, then you can see that the child is having no signs of, just beginning signs of malnutrition, but no bilateral pitting edema. If it starts in 1 feet to begin with, bilateral 1 plus, 2 feet, both the feet 2 plus, then not just feet, using involving the legs, the thighs, then hands and all other things coming up to the face, then it is 3 plus. So, when it is 1 plus, it is mild acute malnutrition. When it is 2 plus, it is severe acute malnutrition, and it is a when it is 3 plus, it is a higher degree of severe acute malnutrition. So, stages of malnutrition can be graded by looking at the bilateral pitting edema. That is the reason why bilateral pitting edema is a clinical sign, or it is a clinical tool, or it is a clinical index which would help to assess the nutritional status of the child or adolescents of the age group of 5 to 19. Now, how diagnosis of severe acute malnutrition can be done? Means we are dealing with this SAM. So, how this SAM can be diagnosed, what are the things which are to keep in mind? See, if the weight of the child to his height is less than 70%, is very important. See, what can be expected is if the weight of the child to his length, that means to his height, is less than 70%, then if you see symmetrical pitting edema on both the feet, then visible by eyes, naked eye, you see the severe wasting of the muscles. And lastly, but not the least, is the MUSE less than 11.5 centimeter. That can grade all, these are the all 4 categories which would help you to categorize the acute malnutrition. So, you can see that weight per height is less than 70%, is very important, along with bilateral pitting edema and along with the wasting, severe visible wasting of muscle, that can categorize the severe malnutrition, which can be recategorized under 2 categories. One is Kwashiorkor and second is marasmus. Coming to the next thing, what the anthropometric indicators they would help you, means the last thing in this module is how we have seen that how these anthropometric indicators will help you to judge the nutritional status of a child or of an adolescent. Now, how to interpret these, means just have to not just have to measure these indices, but you have to take the figures into consideration and interpret it to classify the nutritional status of a child or of an adult of the age group of 5 to 19 years. So, how you can do it? So, there are some key factors which you will have to keep in mind. There are certain key factors which you have to keep in mind. The first key factor is growth standard, which can be used as a tool or a key factor. Now, what this growth standard indicates? This growth standard demonstrates how healthy children grow under the ideal circumstances. This is very important, and you can compare this growth standard with any child which you find or which you think that he has got some nutritional problem or he has got some altered nutritional status. So, first tool or a first key factor which you have to keep in mind is growth standard. The second key factor is the growth reference. Second key factor is growth reference. What it does, how it helps, the growth reference. It describes how a specific population has grown up, but does not necessarily reflect the optimal growth. See, there is a standard figure of optimal growth. So, you can compare this growth reference to understand whether a community of a particular age group has achieved this optimal growth or not. Now, to do that you need to have one more tool, what is called as cutoff. Now, what is that cutoff? Cutoff is a threshold value, that means it is a highest value beyond which an individual may be determined as either malnourished or overnourished, both the things. That is a cutoff. Cutoff of we have seen just till now that the underweight, the overweight, obese and highly obese. So, for these 4 categories to do, we need a cutoff. So, cutoff is a threshold value beyond which you can see on either or, plus or minus, whether the child is malnourished or whether the child is obese. Then one or two more things are there which will help you. These are the tools which will help you. One is Z score. Now, what is this Z score? Z score indicates how far and in what direction the individual anthropometric measurements they deviates. What is the where that particular anthropometric measurement is shifting from the standard deviation. So, there is a particular standard values, there are standard values. So, from that standard values where the particular individuals anthropometric measurements they deviates towards positive side or negative side, whatever, that is the tool what we call as the Z score. And lastly but not least, the last tool which you can use, or last thing which you can keep in mind to interpret these values is a percentile. Percentile, you keep in mind that it is always indicating an individual anthropometric measurement, not the population or not the community. It is an individual anthropometric measurement, and that individual anthropometric measurement you compare with the other people of the same age group and of the same sex to understand the nutritional status of that particular individual. So, this particular module can be summarized as you see in this particular module. What can be the methodology used, means how the anthropometry works for particular this age group of 5 to 19, and we have seen that it works with height for age, then it works through weight for age, then it works through BMI for age, then it works through MUSE, it works through bilateral pitting edema. Then all these things, all these indices which we use, and then we saw that how these indices, that means height for age, you compare the height of a boy or a height of a girl at a particular age, and then see what could be the comparative value, and then you can understand whether the boy is stunted or a girl is stunted. That can be the way in which this height for age can be, that tool can be used, or that index can be used. Then we have seen the weight for age index, just to categorize a child or a underweight or a overweight or a obese, not just child of 5 years, but the age group of 5 to 19. It includes both the child as well as the adolescents. Then we saw the BMI for age. Now, we have seen what is that BMI means and how the BMI helps, apart from the weight for age and height for age. Apart from that, in addition to that, how the BMI helps, that also we have seen, and what are the advantages of BMI to be calculated as compared to height for age or weight for age. Then we have seen the metric and the empirical formula of BMI, how it can be done and how it can be assessed by taking example. That is also very important to be remembered, because anyhow you have to remember that formula, as I can repeat that formula as weight in kilograms divided by height in meters square. That is an ideal metric formula for the BMI, which will help you to calculate the BMI. And then after calculating the BMI, you can compare the BMI just to categorize whether the child is severely underweight, whether the child or adolescent is underweight, whether the child or adolescent is healthy, whether the child or adolescent is overweight or severely overweight. Then apart from BMI, we have seen about importance of MUSE, what is that MUSE is, how it helps, what is the utility of MUSE, how it can be done, and what is the significance of MUSE. As we have seen that it is very easier tool to be used by anybody to, and what is additional thing what MUSE can help us, that what is the risk of death of the children, that can be assessed by only MUSE, not by any other tool or any other index which we have used till now. Then we have seen about bilateral edema and bilateral pitting edema rather, and that bilateral pitting edema has to be under the category of nutritional edema, not any other edema related with any other disease. Then we have seen how the bilateral pitting edema can grade the nutritional status of the individual, and then lastly we have seen how the nutrition can malnutrition can be assessed and nutritional value can be calculated for a child, for adolescents of the age group of 5 to 19. Then what is the condition what is called as severe malnutrition, that also we have just touched under the category of Kwashiorkor and marasmus, and what is the index that we have calculated that weight per height, if it is less than 70% with bilateral edema or without bilateral edema, it can categorize under the severe malnutrition. And in the last part, we have seen what are the tools to be remembered or what are the tools to be used, that is the key factors. As I said, one was growth reference, the growth standard, the cutoff, the Z score, and lastly the percentile. So, this is the way in which, in spite of so many challenges and so many problems, we can use the technique of anthropometry under the category of age 5 to 19 for a child and adolescents to monitor the nutritional value or nutritional status of the child and adult or adolescents of about 5 to 19 years of age group, and then to assess what can be the measures to be taken to improve the health or to improve the nutritional status of that particular individual. Thank you.